going fidget spinner versus my cheek like she did. Now I'm a little bit worried because it obviously messed, you know, that.
Yeah, don't do that.
You can't do that.
Don't do any lacerations to your face. Yes, the face will actually heal better, but you're gonna have a scar on your face. No matter what, there is going to be a line there. No, it'll just stop. Thank goodness. It'll hurt and maybe cause a bruise, ecchymosis.
Ecchymosis.
See how I was making fun of that girl for fidget spinning her face and it not looking real?
It's a decent amount of blood. Look at his shirt. He's got some blood on his right shoulder. Put a lot of pressure on it. If it continues to bleed a lot or there's a gap, you're probably going to need it closed. Many different ways to close it. You can use suture material or stitches. We typically won't use staples on a face because of the holes that makes.
I don't have a Band-Aid, so I'm gonna have to run to the store and buy a Band-Aid.
Put pressure on it. Get some sort of cloth, bandage, not a Band-Aid, but something to put pressure on it to soak a little bit up of the blood to get the bleeding to stop. If you put pressure on it long enough, it will actually stop. Whoa, that's a big rifle. It's not gonna be good. Gonna be thrown backwards. Oh! Somebody left the screw out. He's wearing safety glasses, thank goodness. I've seen plenty of eye injuries where people weren't wearing safety glasses.
So when I pulled the trigger, the gun exploded almost immediately. This cap hit me right there. The other ear hit me right here in the throat.
Oh, wow. They stapled his neck shut. If somebody came in quite stable, I would sew this together. But this patient probably went into a trauma center, and because it's the neck, they probably had to do a very vital section of your neck where your major blood vessels are sitting right underneath there, plus the anterior structures like your vocal cords and your airway.
And then punctured a hole in my right lung.
The apical component of your lung does sit up that high. It could be from either a direct puncture, fractured rib, or just trauma to the area due to force. Obviously, he's got a splint on his nose, so he must have had a nasal fracture as well.
As for my hand, my best guess is this is what did it.
His splint goes all the way out to his fingers. That gives away that there's possibly a finger injury or a metacarpal injury because you want it all the way out so it doesn't move. Versus if it's just a wrist injury, it'll actually just come to this part of the hand. Oh, ow!
It's torn.
It might not be as bad as I thought, though. Yeah. Oh, yeah.
Oh! Just the fact that the way that he's walking, the fact that he can't put pressure on it is not just related to the ligaments, but also the meniscus.
If I had to guess, I think it's
Which, ACL?
definitely your meniscus and the MCL, and I think the ACL is too.
I did a triple whammy? That's great. At least I have this prime.
God, that's horrible. Terrible triad is what we call that when the medial meniscus, the medial collateral ligament, and the ACL are all torn. And that's typically getting hit from the lateral aspect or the outside aspect of your knee. It kind of pops open.
Oh, that was pretty close.
Are we cutting fruit? It looks like we're cutting fruit. Oh, I see the red stuff. I like the 911 call immediately. Sit him down, calm him down, grab whatever you can to put compression to the area. You don't need to see what you cut. You need to stop the bleeding.
Oh my God! Oh, that was not a good idea.
Ooh. Finger's still intact, but you can see him shaking and he's dripping pretty good. The major blood vessels of your fingers are actually on each side of the finger. So if you hit that, you can actually hit a little arterial vessel and they'll bleed pretty quick and be dripping and cause a lot of discomfort. Plus, the nerves run right next to all the blood vessels, so you're gonna cause some pain.
Lance, come on, let's go. Let's go.
If you put the dry tissue on there, it's gonna stick to the wound. I would just wet it. Blood gets very sticky.
Is it sticky?
I don't know how to explain that. I'm like...
People definitely pass out with the sight of blood, with stress. I will say he is very much unlikely passing out from blood loss. You need to lose a lot of blood.
You can break a car window with your fist.
Don't do that. Don't do that. Oh my gosh. All I can think about is the amount of fractures that someone's gonna have in their hand. I mean, at least they're using something to protect their hand, but if they break the glass, it could shatter, could smack pieces of glass in your eye, and then you lose your eye. So please don't do this. Oh, he's gonna lacerate his leg.
Oh.
Yep. Oh, there it is. On the medial aspect, high up there, that's when the femoral artery starts cruising down a little bit more deeper, but something to worry about, as well as the veins there. Gotta be super careful. The veins are much more superficial.
I just pulled the big piece off. Might need to go to the hospital. You gotta go to the urgent care. You're gonna need some stitches. Let's get you into the car.
So that's pretty good. He went to urgent care first. Some urgent cares can fix this, no problem. Some will send you to the emergency department. Urgent care is a fast track kind of business where people come in and out quickly.
Max getting stitches right now. That was a awful way to start the day.
Very good for the doctor, very cool. He's got one of those camping headlights, very useful.
That was a stupid thing to do. That was a stupid bit, and creating entertaining content, we sometimes get carried away. That is a lesson learned on getting carried away right there. Max is a trooper though. He said he wanted us to keep going.
Keep busting myths, boys.
Please, if you're busting myths, make sure you do it with safety precautions and understanding what the worst outcome could be. What did he do? He obviously didn't hit himself on anything outside of the mattress on the ground, but landed sideways and could also cause a little bit of shifting. Unlikely to cause a dislocation, but again, these are all things that you think of.
I think my back cracked! Ah! Oh, I think my back cracked.
Good sign is up walking around. The crack that he's describing is he thinks that he broke a bone. So your back can crack and make noises like going to a chiropractor's office. Typically, you have to have trauma to your back.
My back!
Not spinning, flipping, turning, twisting.
I swear to God, bro.
Lower back pain is like one of the #1 reasons why people can't work. If you do have a lot of pain, make sure you see your doctor. Make sure you go to the ER if it's an acute problem.
Please help me.
Okay, so let me look a little closer.
My eyes hurt so bad.
There's a redness to the white parts of the eye. The white parts of the eye are sclera. You can have what's called subconjunctival hemorrhages or hematomas, that blood vessels pop and cause the white parts of the eyes to get very bloody.
Please, what do I do, bro? Please, I'm not joking. They burn, bro.
When somebody's saying that their eyes are burning, the question is there inflammation, something called chemosis, which is swelling of these tissue, which then can cause the tissue to kind of be more plumpy, so to speak. Multiple different things could actually cause this. Coughing, where you pop a blood vessel, rubbing your eyes, eye trauma. Surgery sometimes can cause this to the eye.
Did it with the backpack. This is the dumbest idea. Let's go.
Looks fun. What'd you do?
It was at this moment that he knew.
Oh, a jump. You do a jump, you're off balance. The question ends up being, do you land directly on your shoulder, your arm? Is your arm reaching out?
Ow. My shoulder's really hurting after that one.
A very common injury that you would get if somebody falls and lands on the ground would be either dislocation of your shoulder or fracture of the clavicle because of compressive force, and it just snaps pretty easily.
So I didn't have a pair of scissors, which is why this is like so primitive here and like caveman-ish, like a Neanderthal ripping it out. I can't trim the on the back.
There's some thick plastic in a lot of these boxes. It could like lacerate pretty easily. You can also have injuries to your hands where you're trying to rip and pull, and you can actually pull your own tendons off some of your fingers. Oh, you gotta be careful with the plastic. You're gonna slice your finger. What did you do? Yeah. All right. Not sure if he just hit himself in the genitals, into the groin.
My groin!
If he did, painful as heck. You're gonna feel pain in your belly, and that's because the testicles were once inside of our abdomens and descended down and out of our bodies. So the nerves are still within the abdomen. That's why you feel it there.
Got some punishments for you.
That bad punishments.
I'm not happy. What is the punishment?
It says you die.
You die.
It says you die.
I did see a nice little Jenga game. My wife beats me all the time at that game.
I don't really know what that means, Ludwig.
Oh, what the heck? What the? Shattering some sort of glass on somebody's head. Hopefully that was super easily shattering glass, but trauma to the head. The first thing I always think about when I see that is gonna be a laceration. The amount of trauma from that distance, unlikely to cause a skull fracture or intracranial bleeding.
Don't you ever come on my stream again.
Because there's head trauma, we're definitely going to still get a CT scan of somebody's head just to make sure, because we are not on scene as ER doctors to actually see the mechanism of injury to fix that laceration, clean it out, clean the wound up. We will either use staples or sutures. Oh! That type of force, you think about a fracture of that metatarsal, which is the long bone of the foot on each toe. But you could also have a phalanx fracture, which are the bones of the toes themselves. Right foot. If somebody comes in with pain to the foot, you're gonna get an x-ray of the foot. Could you cause a dislocation of the bone of the foot? You could. It's a little bit more rare. If it is fractured, depending on how it's fractured, it may need a surgeon to go in and pin it.
Oh, we're juicing it.
Yes, here we go.
Juicy right now.
3, 2, 1.
You know, at first I want to say good job with the eyewear. Have any of you done this before and not eaten the melon? I mean, who doesn't like watermelon? Let me know in the comments.
The juices are coming out of it right now.
Oh!
Are you okay?
Whoa.
Oh my god! Are you bleeding?
What happened?
Is that blood?
Oh
Wait,
god.
are you okay? Are you? Oh my god! It is blood. Do you want me to get a towel?
Obviously, wherever you're bleeding from, make sure you're putting pressure and compression to the area. And don't keep taking it out and checking. You need to hold it at least for 10 to 15 minutes to get it to stop.
Go ahead, let me get a towel.
I fell down on my face.
Oh, you got hit in the face so hard? Wait.
Let me get a towel.
So either he got hit in the face by the piece of melon, or he slipped and fell and hit his face on the ground. It looks like it's coming from his nose.
Your nose!
I fell down.
Whoa.
The floor is so slippery.
Ah, okay, so he slipped and hit his face on the ground. Difficult part is to see where he actually is bleeding from. So either your nose smacked the ground, or he cracked his upper lip open because of the compression forces to the ground and his face, or a dental fracture where you fracture a bone.
We're just gonna do Coke versus Coke and pray I don't die.
Oh! Wearing sunglasses, which aren't safety glasses, could actually cause injuries. Glass bottles smacking into each other. I'm assuming they were also shaken, so they're a little bit more pressurized, so to speak. I do not advise any of this because of the risk of injury. Gotta be careful. Yes.
All right, note to self, boys. Don't smash a Coke bottle against a Coke bottle.
Wow, very lucky. Laceration to the right side of the cheek. If it's super tiny, you may not need to sew it shut. You might be able to cause enough compression to get it to stop bleeding and it heals on its own. Versus, do we use a type of medical glue? There's a brand called Dermabond that is very common. It's like a purple type glue that's sterile.
Hello guys, quick update.
IShowSpeed definitely looks like he's in the back of the ambulance. You can see some seat collars, which are the hard collars that you'd use in somebody who has cervical injuries. And obviously there's people behind him, so he must be in the back of either a transport vehicle, ambulance.
My eyes puffing up. It feels like a stab. It feels like somebody is stabbing my eye with a knife.
Significant swelling to his right eyelid. When you have a lot of swelling of the eyelid, the first thing that we think of is preseptal cellulitis or soft tissue swelling infection cellulitis. Then we also worry about orbital cellulitis, which is actually deeper, which would be a lot more pain with eye movement.
And I have a headache like right in this area. So it's like right in this area. It's literally look just exactly like this.
When you think about headaches, you get cluster headaches, you get migraine headaches, you can get tension headaches. A cluster headache is sharp stabbing pain, typically to one eye. Typical treatment of it ends up being 100% oxygen. You can also use some pain medications.
I don't know what's gonna happen to me, you know what I'm saying? I want y'all boys to always be right there with me until I die.
Swelling in itself of that eyelid can cause so much pain that it hits the nerve of the area of your forehead. Other things you worry about that are a little bit more rare have to do with intracranial things, making sure that his brain is okay and make sure that the bones of the skull are okay. They probably would have done lots of different imaging to make sure that he is all right.
But when I get back home, I'm gonna probably chill for travel for a bit because a lot is going on.
A lot of things this could be. Sometimes people can get allergic swelling, like a local reaction to the eyelid itself, unlikely to cause this significant amount of pain.
All right, come on, y'all. I'm about to use a, I think they call it a weed glass, I think. Oh, come on.
It's a glass. What is he doing? Oh my gosh. People doing like suck and cause suction to draw blood and try to make their lips bigger. No, you're gonna cause injury. You can potentially cause bleeding into your lips. You can cause a lot of bruising, and then you can actually cause permanent disfiguration. There's different fibrotic tissue that can form.
I want my lips big so I can suck.
This is the same idea of a penis pump.
That's not mine.
At least say with a penis pump, it is a tissue or an organ that is supposed to get engorged with blood. Oh my gosh. If you get too much blood within your lip tissue, you can actually decrease blood flow and actually cause ischemia and necrosis, basically where your lips could actually die. Yeah. This is why you don't do this. He's drooling because his lips are so swollen that he's not used to the structure of his lips. We always worry if somebody's drooling, not from the lips being swollen, but your tongue being swollen or swelling in your posterior pharynx because you can't swallow and control your own secretions.
I'm just ruining my life doing this stupid thing, bro.
It is not something that I would advise to do if you're looking for some cosmetic changes to your lips. Seek out a professional, seek out a plastic surgeon.
I got a lot of fireworks right now. Let's light the Pikachu one, y'all. I don't think it's gonna be that loud, personally. Alright! Pikachu!
Well, you're lighting the fireworks in your own house? Totally not appropriate. Don't light fireworks in your house. Don't light things on fire that potentially could explode. Be careful, it's your home. If it gets on fire, you're screwed and then your house is going to burn down. Please don't do that. You gotta have a fire extinguisher or something. Like, put this out. Because you're having different materials that are burning in your home, you actually have an increased risk of cyanide poisoning as well. Now it's on the ground. Now it's gonna be on fire. Firework injuries that I actually see that come into the emergency department where people actually have their hands explode off or they rip pieces of their tissue apart. It's causing 1st degree, 2nd degree, 3rd degree burns. Sometimes people have to have limbs amputated.
I didn't know. I thought it was the popping one, Mom.
Whoa, this is like legit, like he really didn't know. I am just glad that he's okay. Could have been a lot worse because he actually had this propped up on other fireworks. This could have been a huge explosion where all of it got lit and just went up in a big kaboom.
Kaboom. The trampoline's kind of sketch.
It's kind of what?
It's sketchy.
Oh geez, why is it sketchy? Oh, it's not on like a solid base. It's pretty good at it flips. A lot of things can happen on a trampoline. Trampoline! A lot of fibular fractures, a lot of sprains just because you land weird and you tweak something. You try to brace your fall and you roll on it. So a lot of injuries. Oh my gosh, I would get so dizzy, yeah. Oh, he smacks his head right on the edging. You can have lacerations, fractures to the face itself, but then the other injuries that you worry about is the fact that you're immediately hyperextending your neck backwards versus flexing it forward, and you can cause injuries to your neck. No way. Oh, you got a lot of people filming them. Literally during my residency, there was a trampoline park that was built like 2 miles away, and the amount of orthopedic injuries that we saw right after that place opened was through the roof, skyrocketed. Even the orthopedic group had to hire new doctors.
Hot chip challenge!
Hot chip challenge. Oof.
1. Bismillah, Allah Akbar. It's not.
Oh, it's not. It's gonna hit. It seems like this is some sort of hot sauce like challenge, and it's the Carolina Reaper pepper and the stinging scorpion pepper. Super crazy hot. And actually people have gone to the emergency department for seizures, anaphylactic injuries, and anaphylactic reactions and shock. It's gonna hit. I'm turning down my volume. It's gonna start screaming.
It's not hot.
It's hot. So typically, could ice actually help? You could try. You may want to actually think about using milk because of the different binding agents. Sometimes milk when somebody gets pepper sprayed, so same idea.
911, what's your emergency?
I can't breathe!
So it's a difficulty breathing.
I can't breathe!
If you call 911, do they do, hey, what's your emergency right away? Or is there something else that they say? Is this suspect or is this actually real?
Okay.
Where are you at?
Where are you at? Okay, okay.
Ah! I don't want to get that guy.
Is he actually having issues relating to breathing, or is he having a reaction to the hot sauce? Is he having a reaction to the cold, or is he having a panic attack?
All right, so look, Sprite and banana challenge.
Sprite
okay, so first I eat the
banana
bananas and I just chug the Sprite and I just keep drinking it, right?
He's gonna eat a banana, which bananas are good. Bananas are good. Carbohydrates and then good source of potassium. And then he's gonna have Sprite with all the carbon dioxide. So the question ends up being, is there a reaction between the banana and the Sprite that then increases the risk of having a significant amount of reflux and a lot of gas buildup?
Disclaimer, do not try this at home. What am I doing? I am a professional, you know, eater.
He's a professional eater.
Sure, Jan.
Please don't do this at home. All these challenges on the internet and people try them, they come into the emergency department because they've actually injured themselves. Please don't do any of these internet challenges just so you can potentially get viral reaction.
They get what they call rolls.
All right, first banana down the drain.
Typically, your stomach can hold about a quart or a liter, but that's like a stretched out stomach, and that would probably be uncomfortable.
I have to warm up my stomach first.
Some people over time can actually stretch it out even more, just depending on how much you typically eat and how often you stretch. Just depends how much food you can put in there. So that's hard to do. I just drank more than half of that. A lot of stomach distension, a lot of pressure within the abdomen itself. You're gonna feel like it's gonna explode. It won't.
911, what's your emergency? Hello?
I think I'm dying. I think I'm dying.
What happened?
My stomach, it's something wrong with my digestive system.
I mean, how often does he call this 911 dispatcher? That's all my biggest question. I don't know. Do they know him now? But it does sound like the same guy. Is he calling the same guy? Is he in a small town? I don't know. Oh! When somebody gets hit on the lateral aspect of the head, the biggest thing you always worry about is abrasions, lacerations. Those are your first things. Then you think possible skull fractures if there's enough injury. Oh! Okay, so, oh my gosh, so he's bleeding in the mouth. If you get hit in the head and your mouth is open and it causes you to clench right away, you're gonna get cut by your own process. You're gonna bite your tongue, you're gonna bite your cheek. But in general, if you get trauma to your brain, there wouldn't be a specific reason why you're actually bleeding out of your mouth. It doesn't work that way. His behavior, I don't know how to explain that. If somebody has brain trauma and injuries, you could be somnolent, you can be out of it, you can stop breathing, and you can be super quiet. Or you can be hyperactive, not making sense, confused. So it's a huge spectrum of symptoms that can happen. I don't know if he has braces on or not, I can't tell. But for me, when I used to have braces, abrasion, brush to your mouth or the side of your cheek could actually cut your cheek and cause some bleeding. So that's another thing just to think about. So if he's actually in pain and he did bite down on his tongue, he needs to get to the urgent care, to the ER to be evaluated. Majority of the time, the tongue laceration injury, if it's small, will actually heal on its own and you don't need to repair it. It'll heal within 24 to 48 hours.
The Death Nut Challenge.
Death Nut Challenge, what is this? Whoa, I gotta pause that and take a look at that back. The hottest peppers, oh my gosh. I wonder if there's just a ton of sprayed on hot sauce. It's got a burning skull. I'm assuming it's going to be horribly hot. Oh, he's just eating them. Oh my gosh, you know it's a delayed onset horribleness. Work through it, buddy. Work through it. Trying to focus. You're having like a full body response of the burning flavor in your mouth, down your esophagus, into your stomach. You get a stomach ulcer from this stuff. I actually haven't seen anybody come in specifically with stomach ulcers, but people are eating a lot of hot foods and they do get gastrointestinal issues. Oh. Oh, he looks like so much pain. We see some blood coming out of his mouth. Did he bite his lip? Did it cause the gums to start bleeding a little bit on the right side? Or could this be not real blood?
Faker!
I don't know, but you could definitely have some bleeding in your mouth.
Watch this. What? No
Oh, yeah, it's a helium tank, I believe, or for balloons, right? So helium is a type of gas that's light, so that's why the balloons were able to fly. But people will try to inhale or breathe in some helium to
mess with your own vocal cords. Lonely, I have nobody.
If you actually inhale too much helium, it actually can cause hypoxia, and you can actually die from asphyxiation, where you're actually not getting any oxygen into your system. This is actually quite serious, so please do not do that.
I feel lightheaded.
Yeah, typically when somebody's about to pass out, you will have symptoms of feeling tingly. You might see stars, you actually might have tunnel vision, and you're gonna feel quite lightheaded. I tell people in that circumstance to just lay down flat on the ground to make sure you're getting enough blood flow to your brain, and then just take nice, good, deep breaths.
Bro, my eyesight is messing up right now. I'm turning green. Oh my goodness, bro. Go breathe some air, bro. Breathe air.
Oh, good. At least somebody in his live comments are saying, hey, breathe air. Just continue to breathe oxygen through the normal air. What is the percentage of oxygen in normal air? About 21%. The most of it actually is nitrogen.
About to give myself a nose piercing, y'all.
Nose pierce yourself. If you're gonna do a nose pierce, any piercing, make sure it's clean and sterile as possible. Know where you got it from. I actually don't advise you to do this yourself. You may do it wrong. You may stop halfway through. Gosh, please be careful.
3, 2.
Gotta do it quick.
Do it fast. Oh my God, it burned.
Okay, well, we have potential bacteria on our skin everywhere just because it protects us from the environment. So when you actually poke a hole through your skin, you're inoculating yourself or putting that potential bacteria into your tissue and increasing your risk of having cellulitis, which is a medical word for infection of your skin.
Ow! You mean do it fast, man?
Yeah.
All right, come on, speed, baby. Speed game!
So the tough part is he's talking. As you talk, your nose moves because of where it is attacked on your face. I would be very still if I was doing this. Oh my gosh, he is sweating. He is sweating. He's uncovered. He doesn't want to do it. There's got to be a huge mental component of doing self-injections, doing needles to yourself. That's a hard thing to do. Our bodies are not made to cause self-inflicted pain. An obvious defense mechanism that we have that we're not supposed to do that.
It's got a wonderful defense mechanism.
Ow! Ew! Burns and it hurts.
So it hurts and it burns because there's now a new hole in your face. I wonder if this mechanism that he has is almost like ones that we use at work, where if you fully push it through, it retracts when it's done. Versus if you partially do something, it actually hasn't completed the mechanism that it was designed to function as, and then it's still hanging there.
I can't push it out!
Some parts of your nose obviously are cartilage. It takes a very long time to heal, if it does at all, because you have decreased blood supply to those areas. Thus, if it gets infected, it gets very hard to then treat it.
Y'all ready for the cinnamon challenge?
Oh no! Cinnamon challenge, it's been around for a very long time. You have to take a spoonful of cinnamon, try to get it all down within 60 seconds without drinking any water, anything like that. I do not recommend the cinnamon challenge.
If I can't breathe, CPR, you know how to do CPR?
CPR is basically chest compressions to beat somebody's heart for them when their heart has stopped or has gone into a non-perfusing rhythm. So if he's having trouble breathing but his heart hasn't stopped, please don't do CPR.
I can't, like, if I'm like, I can't breathe in, like, do the, like, hold from the back and put your arms on your stomach.
The reason you would do the Heimlich maneuver is if you're choking, to which the object that's causing you to choke is occluding your airway. If you're having trouble breathing and there's nothing blocking, the Heimlich maneuver is not going to be beneficial and it's probably going to cause more issues. You have an erection right away, bad idea. Okay, the cinnamon dries out your mouth really fast, and it can cause you to cough, it can cause you to vomit, it can cause serious irritation, burning, and pain. When you cough, if it goes out, that's fine. That's a normal response of our bodies and our lungs to expel whatever the issue is. But sometimes when you cough, you actually then take a big deep breath in thereafter, which increases the risk of aspirating or breathing in the cinnamon into your airways, which is now going to cause an irritation.
I will be eating a black scorpion that is venomous, sold only in Pakistan.
That is huge. Venomous creature, typically it has to inject something into your tissue versus swallowing. I see people that come to the emergency department that get stung, bitten, snake bites, scorpion bites. Sometimes you can get different types of spiders. Those are the things that we see.
Alright, bro, the black venomous scorpion, 10% chance of dying.
I don't know where he gets this 10% chance of dying. Wouldn't know where that comes from, in the sense of these are quite rare to cause serious abnormalities or serious complications.
My heart's beating, bro. Just honestly gotta do it.
Heart beating because his adrenaline's up. He's nervous, so he's getting a little bit more blood flow, and heart rate's up. His sympathetic nervous system is kicking in. So that's why you're having those effects. Oh, going after it. Okay, focus. Probably tastes awful. He's chewing it. He's not having a reaction. It doesn't happen that fast. If he's having an allergic reaction, it's probably more disgusting, and he has to choke it down, so to speak. He's giving us a nice view. His airway is nice and open. You can see all the way back in his posterior pharynx as he has his tongue down. When I actually ask people to open their mouths and say ah, the reason why you say ah is it drops your tongue.
I'm about to die! I just ate a scorpion, I'm about to die, bro! It's venomous!
So it's venomous is the word that he's trying to say. Again, the likelihood of anything catastrophic happening is super low unless it's related to an allergic reaction.
Ma'am, I just ate a scorpion. I just ate this scorpion. I just want to know if I'm okay or not.
I'm not a medical professional. I can't tell you that. I have to send somebody to you.
Yep.
No, I'm scared. No.
Getting medical advice over the telephone, a lot of times you can't do that. You call your doctor's office and you talk to the nursing hotline. They, majority of the time, will tell you to go to the hospital because they can't definitively say one way or another.
I can't tell you that. I'm not a medical professional.
My advice to anybody, since this is in envenomation, is to actually call poison control.
Okay, bro, I need to call a veterinarian.
What's your last name?
Griffin.
What's your pet's name?
Stewart.
You're probably going to want to contact the Poison Control and Animal Poison Control Center.
Poison control here in the United States is a very simple number. You can Google it really fast, but it's 1-800-222-1222.
Vacuum challenge! Right! Freaking now.
Okay, what is a vacuum challenge? Anytime I hear a challenge
accepted.
It's never anything good. You gotta be really careful with the challenges that you hear randomly on social media platforms. You can definitely see that it's causing compression and tightness to his tissue. So the biggest thing I always worry about is if there's too much pressure on those areas, is it causing decreased blood flow for too long a period of time? The squeezing is too tight, not allowing blood flow to the tissue. That's actually when it becomes detrimental.
It's like a damn workout, chat. I can't move, I swear to God. I swear to God I can't move, chat. I swear to God I can't move, I cannot move.
Sweating bullets, yes, it's not breathable. So as you're increasing your stress, you might start sweating and it has nowhere to go. So you're actually gonna start sweating even more. You don't wanna get overheated and cause other issues.
I have to cool down.
Imbalances in your electrolytes.
Look at my body.
See, it's quite sweaty because it couldn't get out.
I'm glad he helped me though, chat. I probably wouldn't be alive right now if it wasn't for him.
That's what happens when people get into panic attacks and anxiety. In that moment, you can't focus the way that you normally would. In a situation where you start to have panic, take a step back, take deep breaths, and try to focus so you can get out of the situation.
Do not try this at home. I don't know what this is about, but let's go. Straw challenge, baby. Here we go, bro.
Okay. Oh God, be careful, you're gonna inhale that. Yep, yeah. He's trying to use a massive straw to drink milk. So it's very difficult to drink in that position with that amount of volume coming in. So then do you get it in your airway or not? Typically, if you're gonna get something in your airway where you aspirate it into your airway, it's gonna cause you to immediately start coughing and choking. He's freaking out. Come on. Sometimes you can pass out from the simplest things, and it could be just from your brain-nerve interaction. It messes with blood flow relating to the rest of your body because the nerve sends a funky signal to your heart and causes a quick arrhythmia, boom, and then you can pass out, and then you wake back up shortly thereafter without any long-term issues. Say you come across somebody who's in this situation and you don't know what's actually happening. Most of the time, you basically want to either lay them on the ground, lay them on their side, and make it safe for that individual. It helps clear the airway, and then it basically allows normal blood flow.
Oh, bro, I thought I died, bro. I swear to God, I almost died, bro.
A lot of times, too, you won't actually remember what happened. So if you have a seizure, you don't remember what happens.
Where am I?
It actually causes an issue with that. A syncopal episode, when you pass out, you actually don't remember what actually happened during that event either. You remember just before it and just after it.
What?
Nice. When you're lifting by yourself, it could be beneficial so you can actually slide the weight off if you get stuck. But if you don't lift perfectly straight, it could start moving and then it is off-centered, so you can actually have a more difficult time trying to lift it. So now he's stuck. And I know you've definitely seen lots of videos out there of what people do when they get stuck. The biggest thing you do is probably try to either roll it down your abdomen to your hips so you can stand up, or you try to dump the weight on either side. So again, a little bit of panic. There you go. Take your time.
Keep breathing. Stop, I can't breathe.
One, he's saying he can't breathe because the bar is probably resting on his chest. It's definitely a moment where everybody panics. He's trying to actually dump it and the weight's getting blocked. So the best thing to do would be to try to lower it down your chest a little bit to then get it to turn over. There you go. So just that movement right there where it's partially off his chest at an angle gave him some relief, so his right side of his chest is actually free to expand. There you go. There you go. Now it's on the floor, it slid off. Typically, you don't see people come in with like fractured ribs of the chest in this situation unless it fully drops. Drop! You have cartilage on either side of your sternum that actually can give a little bit. I've been in situations like this. Either you're not strong enough at that moment or you took it to one extra rep that you shouldn't have and you're in this circumstance. Oh man. Oh my gosh. No. Wait a minute. You have to worry about your hairs getting singed. If that happens, oh, the smell is horrible. If it gets too close to your skin, you're gonna have potential 1st degree, 2nd degree, 3rd degree burns. And then you have to worry about breathing in the fumes. You can actually cause some inflammation to your upper airway. Oh, get him, get him, get him, get him, get him, get him. Oh my gosh. Well, he falls and he lands on his feet. So you got maybe a fighting chance for a couple seconds. But then he falls and lands on his hip, his butt. Highly likely that it turned from a 1st degree burn, which is like a sunburn, to a 2nd degree burn, which is really, really painful. All right, first off, he's wearing a helmet. We got safety. Oh. Whoa.
You all right?
Why?
I think it's like the.
Oh no, clavicular fracture. No, AC separation. Oh, what? Looks like he has some sort of clavicular damage or injury. Falling either directly on your shoulder causing compression, it can snap. Falling with an outstretched arm, which puts the force there. Typically, it's just a sling and it's gonna heal on its own. Oh, nice. An ice plunge. Nice flip, buddy. Going in ice cold water. Super good, releases cold shock proteins, releases norepinephrine, epinephrine, producing good, happy feelings. But sometimes cold submersion could cause you to spasm, seize up. You might not be able to swim out of a situation like that. Oh, that's nice and cold. Good work. He's so happy. I love it. He's happy because he's so energized. I did this actually the other day. I threw 20 pounds of ice into my tub and just sat in it. My wife thought I was crazy.
I'd like to try to break the most light bulbs that anyone has ever broken with testicles. Done.
They're gonna pop easy, right? Because they're fluorescent type light bulbs that you use overhead, but they're like super shards of glass that potentially can rip his scrotum open.
A row of 36 light bulbs with my balls. Wish me and my balls a lot of luck.
At least he is covered clothing-wise and he's wearing eye protection. Normally, Steve-O's wearing a Speedo, so it was weird to actually see him clothed. Oh, nice, nice. It actually kind of looked fun. Every now and then, everybody likes to break something. In this situation, thank goodness his scrotum and his balls were actually covered, because if you did it bare, then it can cause a significant amount of lacerations.
We're gonna play the black eye game, and here's how it goes.
Oh. Oh my gosh.
That looks pretty good.
Wow, okay, oh my gosh. Black eye is due to the pooling of the blood on the underside. There's a bone in the middle called the lamina papricia. Typically, if that has a crack in it, will allow blood to kind of seep through. What the hell is that? Very poisonous, but not deadly for humans. That thing is gnarly. This freaks me out. Even when I'm doing my job and I'm pulling out a bug in there, I got a good game face. But inside, I'm like...
Once a WB, always a WB.
Oh my gosh. Oh my gosh. Is he chewing it or is he letting it in his mouth? Oh my gosh. That is ballsy. No way would I do that. No way.
No way.
Imagine like the spider bites your tongue and you have an allergic reaction. Your tongue is like huge and swollen. No, 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 no. Ow, did he break his leg? What the heck? Super cool in the air, but... Oh! Okay, wait a minute. He does a really good job as he's falling. His knees are bent, but then what happens is he actually lands a little bit more stiff unexpectedly without the board under him. Oh, yeah, I told you. Man, that's either a dislocation or a fracture dislocation. First, he should come in with it splinted. We actually try to put dislocations and fractures back in place as quick as possible. You increase the risk of arthritis in the future the longer it's out.
My right ankle was dislocated as and broken in 3 places. That's a mess.
Basically, you're fracturing both malleoli, so your fibula and your tibia, and then the backside is disrupted. It's called a trimalleolar fracture.
I fractured my left heel too. So I'm going into surgery in 2 days. I'm having a plate put in with 9 screws.
So if you fracture your calcaneus, which is your heel bone, you always worry about fracturing any part of your spine because of the amount of force that it takes to break that bone is a lot.
2 days, I'm having a plate put in with 9 screws. Yep. 7 on this side, 2 on the other side. But whatever, I heal like Wolverine.
He heals like Wolverine. I love it. You know, I wonder how much metal is actually in Steve-O's body. Palm trees have like little splinters all over the trees. You have to worry about getting impaled by the branches and scrapes and obviously falling from that height. Nice. Ouch. Hopefully he knew that that table would collapse, because sometimes the tables don't collapse. It can cause a significant amount of injuries, including fractured ribs, broken vertebrae in your back. I don't know how disgusting and murky that water is. I really hope his tetanus shot and all his vaccines are up to date, because we don't know what's swimming in that. When you fall, you want to like drop and brace yourself. So be careful reaching out with your arms, because you can fracture your forearm, fracture a wrist. So keep things tucked in and try to tuck in, like roll. All right, Gordon.
No, but the temperature of the sauce.
It's plenty hot. Okay,
Dumb but tough. I love his t-shirt. Oh my gosh. What spice is he? How hot is this? The ghost peppers. Into his eye. Oh my gosh. Oh my gosh. I thought he was going to drink it. Gordon Ramsay is like laughing at him. Yeah, wipe it. Get out of there. Why would you do that? First thing you do, you gotta wash out the eye. Biggest thing we worry about, corneal abrasions, corneal ulcerations, or corneal lacerations. If you have some sort of injury to the cornea, it hurts like a son of a bitch. You're gonna need medications, pain medications, topical antibiotic ointments, or drops that we use, and then get to the ophthalmologist. Okay, what are we drinking? Don't know. Okay. Oh, you can actually dislocate a jaw with that speed of the ball. You can actually cause a tympanic membrane rupture or an eardrum rupture. If it hits the ear, you have to worry about a hematoma, like the cauliflower ears that a lot of MMA fighters get.
So what this intro was meant to be was me hitting the bucket of drinks all over my mum, but instead, yeah.
If she was drinking something, I've seen people get their tongues lacerated by their own teeth because they bite down on it. There's a million different things that could happen in these situations. Yeah, I don't think I put my mom in that situation.
All right, put your head down. Okay, and yeah.
It's a paintball gun? Air gun?
3, 2, 1.
Oh! Oh! An air shot. Oh! Hitting right on the midline at the spine. Don't shoot the bone, hit the soft tissue, the muscle. You have these really strong, thick strap muscles on your back. They're called your paraspinal muscles. You might as well use them. Oh, no, paintball. Oh. You definitely increase the risk of actually getting fractured, especially this type of frame and body where he doesn't have that much adipose tissue, which is basically fat tissue. If they hit the spinous processes, there's a chance you can potentially break them.
Yeah, 2, 1.
Oh! You know, I wouldn't do it in front of the window only because if you miss, so you gotta break the window or not. I don't know why people do this stuff. If you're gonna use a paintball gun, go play paintball with your buddies. It's more fun that way versus just taking shots. Oh man. Oh, look at the welts.
Okay.
Ouch. So you're getting a hematoma. You're already getting some broken blood vessels around that area. They're gonna have some big bruises in the next couple of days. In medical terms, we call them ecchymosis. And it's gonna change from black to blue to green and yellow as it continues to heal. That was not the smartest thing in the world. You got the basketball hoop anywhere between 10 to 12 feet in the air. He's probably up 15, 18 feet himself, which is 3 times your normal height. So hopefully, if he was smart in his filming, that he has some sort of crash pad underneath that he can land on in case he fell off the roof.
The first player to drop the other participant secures the money for the team, whilst the loser does more shots.
Oh. Oh. He's screaming bloody you know what because of the amount of pain. You're popping blood vessels, you're hitting the skin, you have nerves to the skin, you have nerves to the underlying tissue. So it's gonna cause a lot of pain and it's gonna break a lot of capillaries and blood vessels as well as a hematoma. Hematoma is a collection of blood underneath, like a pocket, versus the ecchymosis is just the integration of broken blood vessels within the tissue itself. Oh my gosh.
Quiet, bro, it's too late. It's annoying.
That is why I don't do bungee jumping. I'm kidding about the bungee jumping. They're very safe. They do a lot of testing. If you want to do that, enjoy. Go ahead. Just make sure they have good safety profile and all their certifications and pass all their safety tests. But ouch.
Ouch.
You got to be careful. I'm surprised he actually didn't fall forward. And it was interesting because I think the other guy knew it might snap because he wasn't running as hard. Oh! That looks so much fun. It slams his head back. That's whiplash. If there's enough stretch on the spinal cord, it can actually stretch it out. You can have some blood get in there. You can have some inflammation. You can snap the transverse processes. You can snap the spinous processes. A lot of things that are not good that can occur. And insult to injury, he nailed his tailbone, AKA his coccyx. This looks like grass or some sort of synthetic grass. So at least it has some sort of give to it, but it's still gonna hurt. You increase the risk of fracture versus dislocation of that tailbone. Oh no, oh no. Whoa. I have inappropriately climbed the roof of my old house when I was younger. You have to be super careful. This is really dangerous. You can land, you can snap an ankle, you can break your calcaneus. Don't do any of these things at your house. It's not worth it. He lands on the roof with both feet of the car. He actually ended up rolling with it. So I always tell people, if you are going to fall and roll to take some of the force out. Look at all those people who do parkour.
Parkour, parkour! Oh, I'm so sorry.
An abrasion burn to his elbow. It hurts, it burns, it's treated with bacitracin, antibiotic ointment, which you don't necessarily need right away because there's no infection. So you can actually use like Vaseline or something that's like petroleum based.
It was at this moment that he knew. He up.
Oh. Oh.
Ow.
Oh Oh my gosh. So I don't know if any of you out there ski or snowboard, landing on the hard packed snow. No, not fun. Definitely increase the risk of breaking something.
Moments later.
And broken collarbone.
Oh, clavicle fracture. Ouch. The clavicle sits right here in between your shoulder and the manubrium. When you land on your shoulder, you can cause a fracture of the shoulder or a dislocation. But if that stays intact, the force goes inward, hits the clavicle. The clavicle is super small and it just goes.
Displaced, fractured.
You can see how it's popped up and it's pushing up on the top of the skin there. That's actually a good x-ray.
So for this bad boy right here, I'm gonna have surgery, metal things inserted.
So the surgery that you're gonna have, it's a metal bar that's gonna have some screws in it. Basically a placeholder. Sometimes they can go back in and remove it later once the bone is hard enough.
Oh my.
Look at the size of that piece of metal.
So wait,
So that's in your shoulder.
your collarbone's here, rib cage, arm.
God. And then there's 3 massive nails. Oh, like, do the nails really need to be that long?
Wait, what do you mean 3? There's 6.
Yeah, 3 at the sides, sorry, yeah.
Look at that hardware.
Yeah.
Actually, you can see the skin staples as well. See those little square looking things? Those are the staples to actually close the skin. Oh! That is just messed up. Oh! Talk about a potential for fractures. You're not paying attention, you're not aware, your body is relaxed, and all of a sudden, boom, you get nailed. You're not tensing up against it, you're not ready for it. Get ready. Oh. The people in the bubbles as well, do they cause themselves any injuries, or is it just, you know, being surrounded by one big airbag? Has anybody played with these things before? Let me know in the comments and let me know if I should go check it out.
I'm Coyote Peterson, and I'm about to enter the spike zone.
What? Come on.
Come on!
This one was complicated. Are you allowed to have the fish out of water, though? Yes. Okay. For a short amount of time.
Oh. Here we go.
See what happens.
3.
Ow!
When these fish are defending themselves against predators, it's probably something that's come in and is biting it, so those spines go in. There's gonna be more impact. But think about it. How difficult is it to force something to penetrate your skin?
It actually takes a lot of effort, even when we do these really super sharp needles.
Yeah.
It's actually really not that bad.
You have a significant amount of veins on your hands, so you could potentially puncture and get that sting directly into a vein.
The amount of pain that I was going through is probably a fraction of the amount of venom that could possibly be injected.
You see where the spines went in? There, and I think his body kind of turned.
So do the spines ever come out and like stay in?
No, it's not like quills of a porcupine.
Probably went into like the subcutaneous, just underneath the skin. Unlikely into the muscle, but it could. And then now you're experiencing that toxin that it has.
Hold on a second.
These fish are incredibly resilient. It's worth noting there's a massive invasive species in the United States. And fortunately, the population is kind of getting under control. They have these lionfish hunting tournaments.
It's kind of coming in a wave. All right, I'm gonna take this thing off of my wrist.
Now that's probably a thing that a doctor would suggest, right? Get this leather thing off.
Correct. We don't like anything that constricts. So we have had discussions before where it's like, hey, rings, get them off your hands. Make sure they're not on there because your hands can swell.
And what you don't want to do is cut off the circulation.
See, look at that. You are a professional.
A doctor,
that's right. That's right.
Feel my forearm, dude. That's like instant. Squeeze under here.
Intense. Do you feel like it's like getting hard and swollen?
That's what she said.
Could be related to you wearing bracelets from the sun, or if it's starting to swell, it actually push on that and actually blanch out your skin.
I felt the spikes go in.
See, there in the slow motion, you can kind of see a force that I had to get.
Yeah, it was like a karate chop.
You know when skin pops.
Oh, yeah.
It's weird. It's like almost like saran wrap.
That's kind of like a pinprick. Big pin, but a pinprick nonetheless. I kind of got up and said, that's not that bad.
Somebody came to the emergency department. Make sure your vital signs, which heart rate, blood pressure, all that stuff, are just fine. Make sure you're not having an allergic reaction or anaphylactic reaction. And then thereafter, it's just pain management. Typically, we start out with anti-inflammatories, and then if that's not sufficient, we can go to an opiate.
Okay, it's getting worse, guys. It's getting worse, and I'm getting dizzy.
And it does. It escalates. And that's the thing that I've noticed with a lot of different venoms that are specifically marine venom begins to build.
For your scale of 1 to 10, where would it fall for you?
I may have noted it in the episode where I felt, so I can't remember, so I don't want to contradict myself, but memory looking back on this all those years ago, I would say it was probably in the vicinity of a 5 or a 6.
I'm Coyote Peterson, and I'm about to enter the sting zone with the cow killer.
What a beast.
Is it a cow killer because it kills cows?
It's technically a wingless wasp. The old-timey tales would say it could kill a cow because of how bad the sting hurts, hence the name cow killer. It would not kill a cow.
Oh, okay, trying to sting you.
There's where the purchase happened, right there.
That happened so fast.
So fast, but you can see how thin the gauge is of that stinger when you think about that.
Yeah.
I mean,
you could see it just like testing the waters.
Well, it was just kind of missing. I don't think it was so much gauging as it was like, where am I going to actually hit with?
You were like instantly like, oh, that doesn't feel good. Immediately.
Oh, it's immediate. Yeah.
Wow.
Oh my gosh, guys, this is super bad.
Describing is super bad. Doctors always ask, please describe it. And you're like, it hurts.
Well, it hurts.
Is it burning, pressure, sharp stabbing? Is it throbbing?
The venom is designed to react immediately. So it is a searing pain. And this species specifically is more robust.
Hold on, I gotta try to control my heart rate.
These guys are hanging out on the ground. People mostly get bitten just because they're walking around and they don't see them.
That's a great question. So when you disturb a wasp nest, it's usually something trying to defend its own. Because these little velvet ants are solitary, they're on the ground, all interactions happen with people accidentally stepping on them.
It feels like I'm getting stung over and over again.
Still continuous feeling?
Yeah, and that's the one thing that a lot of people will tell you about stings is like there is then that secondary effect, and I'm assuming that is just the neurotoxic properties,
it's working.
which I now know more about.
Is that all around the sting is tingling like these little tiny pincushion needles going tss, 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 tss.
That electrical impulse, I guess my question to you as the doctor, is that the neurotoxic property?
That is your neurotoxin property, is messing with your nerves. You're also dealing with the pulsatile component of it, your blood pressure, heart rate, adding into it.
There's all these little red dots forming, and I'm assuming that is where the venom is spreading.
1 to 10, where would you put it?
I would probably put this towards the 7.
Got it.
But the good thing about this is that it's a pain that doesn't last exceptionally long.
I'm Coyote Peterson.
Look at this shaved, young, strapped man.
And I'm about to take on the Bee Beard Challenge.
You know that thing that was on my chin?
Yeah, I saw it. It's not your hair.
Pheromone. That is a pheromone stick with the scent of a queen bee.
How you feeling now, Coyote?
It's a lot of bees.
Have you been stung yet?
No stings yet.
So the shininess that you see on my face, that's Vaseline to try to prevent the bees from wanting to go up into my eyes. We had Vaseline in my ears and on my nose. Chris, our amazing bee expert, said I would be completely fine.
That is a lot of bees. I would not be comfortable.
My neck is getting stung again.
So you're saying you're getting stung as this is happening?
Yeah, I got stung for the first time like twice very early on. And that was very unusual.
So what is Coyote Peterson?
That is a stinger lodged into my lip.
Yep.
And like that's a very sensitive part of the body.
Yes.
As I'm sure you
can and it'll swell up real fast.
Yeah.
Yes.
Oh, the lip again! Oh, no!
The lips are just almost to your mucosal membrane on the inside, and it's like that transition. When you start getting around the face, we get worried because of swelling and then your airway, and it gets very concerning. And don't move, he's gonna take it off. Literally, you can see the stinger.
Yes.
He's grabbing it with his fingers. That bulb still has venom in it, so he is squeezing it.
Sac.
Yeah, so now he's going to squeeze it to try to get it out of you, and is gonna inject more venom into you.
Probably a good chance.
Yes. I always tell my patients the appropriate way is to use tweezers as close as you can. Don't squeeze the bulb to pull it out. You can use a credit card or any type of card to slide across. Obviously, you can use duct tape. Certain things you can't get a good grasp on, you can actually use like Elmer's glue.
Oh, same spot!
Is somebody giggling behind you?
That's Mark in the background. Everybody was like starting to laugh once they're like, man.
Okay.
There I got stung again.
Wow, they're going after your lip.
Well, here's the thing. Once a single bee stings, it is going into defense mode. So it's releasing a pheromone that's saying, this is a thing that we're targeting.
Get them. Oh, but you've almost got it. You're so close.
Oh my gosh, that's gonna hurt. Yes, it is.
You got it. Power through. You got this. You already got it.
At that point, it becomes a lot scarier when you've got your eyes closed.
Your proprioception now is going to be off. So, you know, where you are in the world, you're going to start feeling dizzy. You're going to feel like you're going to falling over. So, you're good.
My eyes.
Very smart.
I'm getting stung a lot. What you're not seeing is that the amount of times that I started getting stung from the pile of bees that was on my face.
I'm covered in bees.
Actually, literally,
it like drew blood.
Yeah, it like got blood to the surface. You just got stung like 40 times in the face by honeybees. 40.
I would probably say, Coyote, let's give you an EpiPen so this doesn't progress more. Do you typically have EpiPens on set so you carry them with you? Oh, you literally
right now, as a matter of fact.
You carry it with you wherever you go now, just to make sure. You never know.
The bee beard is
not. Oh my gosh! Holy cow! People pay good money for that,
right?
Oh
That's what you call lip injections.
Yes. 1 to 10 on a pain. Where would it be for you?
I would probably say a 7, but the thing is, once that pain wears off, it wears off a bit more quickly than some of the other venoms that I've taken.
I'm Coyote Peterson, and I'm about to enter the nettle zone with the Gimpy.
What the heck is a Gimpy? It's a Gumby? No.
Trust me, this is no Gumby. One of the top 3 most painful experiences I've been through.
With a leaf?
In Australia.
Okay.
So you're fine here in the United States.
Yeah, that is a big leaf.
It is a big leaf. Believe it or not, somebody once wiped their butt with that leaf. So this is what we would consider a nettling. Imagine shards of fiberglass, if you will, or little tiny hypodermic needles. So if you looked at this under a macro lens, it would look like a bunch of snake fangs.
Holy cow.
Instantaneous.
All right, you can see where the redness is starting to set in there.
So redness is basically your inflammatory markers, maybe a neurotoxin again that might be going on here.
Dude, the pain receptors for this specifically, so it's considered the most painful stinging plant in the world.
Wow.
On fire and being electrocuted at the same point is exactly what this feels like.
Yeah, that burn.
It is continuing to build.
This is the kind of pain you think you may be better off cutting off your arm than risking this going
that bad.
It is that bad.
Now, when you think about it building and getting worse, I'm about 1.5 minutes in.
This lasts for a considerable amount of time. 24 hours of really intense pain, but then I continue to have pain and ultimately what I believe is nerve damage for 6 months after the fact.
My whole left side is like, oh, so uncomfortable. All the way up my arm, into my shoulder, and into my chest and my lymph nodes.
Your lymph node is like, you think about your lymphatic system as train tracks.
Yeah.
And the lymph nodes are the train stations. So it's where everybody gathers. And when that starts swelling, especially in this type of reaction, they also get really painful.
Yeah.
And so it's hurt, and you have a lot in your armpit, a lot in your neck.
I'm Coyote Peterson, and I'm about to enter the strike zone with the American alligator. You ready?
Oi.
So the purpose of this video was to show you why you would not want to get a baby alligator as a pet, because they grow into a 4-foot alligator very, very quickly.
Got it.
Oh yeah, he is into my arm, and he is holding on.
The handler that's holding onto the alligator, did they describe that it was trying to move?
No, the alligator actually stayed pretty calm through all of this. One of 3 ways this could go. The bite and shake was the first thing we wanted to eliminate, and then it was, is it going to bite and let go? Because this is not a feeding response, or is it going to lock in place? It locked in place.
Yep. All right, that feels like big needles going into my forearm, and I can see there that those teeth are deep down into my skin.
We don't see typically alligator bites in Southern California, maybe Florida, but any type of long, sharp tooth becomes a puncture wound. Say you get a slice of normal laceration, we clean it out with a lot of water. Puncture wounds, you can't, it's a hole. So you can't clean it out well.
I think to get him to let go, I'm gonna try to just pry his jaw down a little bit.
We treat every single puncture wound as the potential that it's going to get infected. So you do cover it with antibiotics, but even then when you do oral antibiotics, which we call PO antibiotics, they may not work, and then you might need to be admitted for IV antibiotics because it just doesn't get into the tissue well enough.
It's the underside that hurts the worst. She's biting down harder and harder.
Has nobody come up with a device that can be put in an alligator's mouth to then open it up if this were to occur?
Maybe like some sort of
just like a little
very dense inflatable bag that you could put behind the mouth. It could work, but what are the odds that either A, you have a reason to purchase that, or B, you're gonna have access to that?
Right.
Ooh, yeah.
2 big bacteria that alligators harbor is staph and strep. People say, oh, I got a staph infection, or strep related to, we always think about like strep throat.
Yeah, that's where I was like, strep throat.
But it's actually very common, like skin as well, bacteria. Also causes pneumonia.
You can see there's a big hole went into my arm at that spot.
If I visit an area that has a lot of alligators, I come like face to face. Do you have like any recommendations of like what to do?
That's a great question. I mean, environmental awareness is key no matter when you're in an environment that you're not familiar with.
Yeah.
And if you see a body of water in Florida, you should assume that there is an alligator
right there.
This is the second Gila monster that we've encountered in the Sonoran Desert.
Look at that. Oh, GoPro. Gila monster, which is a rather cryptic species. People don't come across them often.
Right, I've never seen it.
A famous saying that only an idiot gets bitten by a Gila monster. It's because the bite for Gila monster is more of a defense than it is to take down its prey.
Oh.
This was
so
scary.
Wow.
This is just like pure panic mode, and it was immediately searing. My thumb was in that lizard's mouth for probably less than a second, and the razor sharp nature of the teeth sliced through my finger in multiple places.
Me keep thumbing? Oh, yeah, he got the whole top of my thumb. Yeah, we're past the GoPro, and he got the whole top of my thumb.
Were you in pain because of the laceration initially, and then because of the venom? Did the venom happen that fast?
It was venom. I knew it immediately.
Just stop filming.
We immediately started making phone calls to reptile experts that we knew. Everybody's like, yeah, man, there's no anti-venom. It was a graze. Okay, there's a big difference between a graze and the lizard being locked on your hand and pumping venom, which can kill you.
I grabbed onto my finger the moment that I was bitten, and almost immediately the pain from the venom started surging through my hand.
Felt lucky to be bitten on this hand versus the side that my heart is on.
So the heart is in the middle of your chest.
Oh, it's not over here?
It is bottom
So where
part.
is my actual heart?
So it's pretty much right
about right
here.
there. Okay.
Yeah.
We monitored my body for hours at a time. We made sure that my heart rate was low. We monitored the swelling. We took photographs, as you'll see some of the photographs here, as the hours went by.
This is kind of a rare thing. If it would come to the emergency department, we're gonna make sure you're fine, but then we're gonna call an expert, call the tox control first. They'll try to get on the horn to anybody that's a reptilian lizard expert and be like, okay, this is what you can and can't do.
The pain was so excruciating, I really just had to go into a mental state where I told myself, you can make it through this pain. It was the worst pain I had ever experienced, the throbbing, the squirming of my body, and of course the constant fear that, is this only going to get worse?
Burning, ripping, pulsating, throbbing, tight. What would you describe it?
Hot lava coursing through your veins, which is exactly what you will read on the internet.
As the venom started traveling up my arm into my shoulder, I didn't know at what point it was going to stop, and that's when I really started to get nervous.
I can distinctly remember for almost 8 straight hours the pain as the venom was working its way up my arm.
It was breaking down all those structures within the tissue. Your fingers, the circulation isn't the best down there, so it does take a little while.
It was really mind over matter at that point. The fact that I didn't go into any sort of anaphylactic shock, I knew that I was going to be okay.
The venom from the Gila monster has actually been used in medicine. One of the components, the zenidine, is basically a precursor to one of the medications that we use for diabetes.
Diabetics. It was just a matter of toughing through the pain, which was, kind of like they explain, hot lava coursing through your veins.
In these situations, you don't want to run. Your sympathetic nervous system, that fight or flight response is going to kick in. Your blood pressure is going to go up, your heart rate is going to go up. You don't want to add to it by running and increasing that demand on your system. Coyote did the right thing in the sense of like, assess the situation, be like, okay, what do we do?
That is the invasive Burmese python there.
I mean, it is a beautiful snake. I like to look at them from a distance.
It's a hugely invasive problem in Florida, yeah.
Do people have them as pets?
Oh yes, and that's probably where some of the problem originated.
I'm gonna go right for a second.
So this was just an error, what you're gonna see here.
Oh, hey.
Grab just like
too far back.
So anybody who's ever been bit by one will be like, yep, there's like about a centimeter's difference between where you get that snake and its ability to turn and get you versus not. Fortunately, we would consider this a small python.
Great, yeah, I'm okay. Man, those teeth are sharp. He moved forward just as I was.
Look at that, that's like a big chunk. Oh, it came out of the cat.
Yeah. Now imagine if it was a venomous snake. That is how quickly these sorts of things happen. Snakes are fast. When it comes to the pain, really not that bad.
I know you don't use it for this purpose, but your leather would have protected your major arteries of your wrist.
Yeah.
God forbid it was a little bit closer to the wrist.
Look at that. That is a python bite right there. All right, hold on. Let me try that again. You ready?
Hey, wherever's like,
don't do this, but let me do this again.
Yeah.
Oh, there we go.
Okay,
Look at that
super
mouth.
close. We've had times where individuals like, I think I got bit by a rattlesnake.
Yeah.
And we're like, we don't have any evidence of it, and now we have to wait and watch.
I've never been bitten by a venomous snake accidentally or intentionally. Never would. You're talking about a medical emergency when a venomous snake is involved.
We assume any bite that we see is a venomous bite until proven otherwise.
Exactly.
All right, good thing I've got him the second time. Look at those razor sharp teeth. Man, that's what just went right into my hand.
Not every single hospital out there actually has anti-venom, even in the United States, but the hospitals that don't have it will know which hospitals they can send individuals to.
1,000 bloodthirsty mosquitoes.
I'm pretty sure they're all bloodthirsty, right?
No, they're not.
Oh!
Only the females. Considered the most deadly animal on the planet.
Because of what it potentially could do.
Yes, hundreds, thousands of people die every year from mosquito-transmitted diseases.
Without further ado, it's time for Coyote Peterson to be eaten alive by mosquitoes.
For anybody wondering, could these mosquitoes be infected with diseases? These are lab-grown mosquitoes, so we knew they were free of disease.
I want to make sure. Oh wow, look at that. They just went straight for my wrist. I definitely feel something going on right now.
That's a lot on my arm.
That is a lot.
That's too much, man.
It takes like a second or two to realize that they're biting you and having a meal on you, right?
Yeah, they do have a slight numbing agent in their saliva.
Right.
Sometimes you feel the bite, sometimes you don't.
Oh, actually, the one right in the center of my hand, I can really feel.
All I know is that when I'm late to the party and I see one and I smash it and my blood goes everywhere.
But is it your blood?
The itching is beginning to give its onset. And it's really the mosquitoes in between my fingers right now that are the most uncomfortable.
Could a mosquito bite an eyeball?
Yeah, totally.
Would you get a lump on your eye?
You potentially could. When we see swelling of the eye, it's actually something called chemosis.
Ooh, that sounds like a bad mixed drink.
Yeah, it does.
Itching, swelling, and an uncomfortable annoyance.
The level of agony is best described as the itch you can't scratch.
Mosquitoes are not venomous.
Right.
So why do those little bumps form on a human skin?
Inflammatory reaction of, I just got a foreign attack. Think about this, if you get a puncture wound, a cut, you still get the same kind of swelling
Right,
reaction.
because the proboscis is still inserting itself into your skin.
My arm has been out of the box of mosquitoes for about 10 minutes now, and you can clearly see that the welts are beginning to form.
Does blood type have an effect on mosquitoes? They've actually done research on this. In other words, do some blood types get bit more than others by mosquitoes? And the answer is yes, it's blood type O. And they actually shown there are certain blood types that would react a lot worse.
I have counted, as we were setting up for the cameras, nearly 250 bites.
My blood type is AB positive. Do you know what your blood type is?
I have no clue.
I call it the most selfish blood type because I am the universal acceptor. So I can take anybody's blood under the sun. I can only give it to AB positive.
Wow.
That's not to say that there aren't bites on top of bites. So I'm just gonna round up a little bit and say I got 300 bites in that matter of time.
What happens if you get a bunch of mosquito bites and then you have some sort of weird reaction after the fact?
Get to the hospital, get checked out, because there's different tests that we can do. Some of the viruses we can look for, other ones we may not be able to. And then even with malaria, it's actually done as a blood smear to look at your red blood cells.
For this experiment, we have a more modern warhammer. It's a tactical warhammer.
Go here.
It's a pretty good one.
Oh, come on.
Come on! That warhammer wasn't like super hefty, so there wasn't a ton of weight behind the swings.
Yep.
That one in particular was like made out of some like polyurethane.
Okay.
So it was a little lighter material.
Right. Actually has to do with how strong the person wielding it is actually swinging it.
It actually hit me right in the back of the cab!
Oh, thank goodness.
Is that a bad idea?
All I can think about is Houdini. Didn't he die when he got punched in the stomach?
That's what they say,
Okay.
but I wasn't there.
Data has indeed
Whoa.
formed.
Instant bruising. If you get hit so hard, you can actually cause pancreatitis.
Oh.
But unlikely to perforate your stomach.
Gotcha.
It's just going to cause more bruising than anything.
It sent a
horrible pain.
Loose shooting pain down my arm.
Yes,
I think he hit a nerve.
So you have big deltoids. I'm assuming that probably didn't hurt as bad.
The shoulder definitely not as bad as the stomach. It does feel a little bit weird when you're getting clipped in that bone. Right
Oh,
up at
if you hit the
top.
bone.
That even pokes out for me, even with the muscle surrounding it.
Yep. Oh my God.
compared to getting hit in my quads opposed to my hamstrings. The hamstrings tend to sting more.
Probably because you're more developed in, your quads than you are in your hamstrings. And quad has 4.
Yep.
So you got 4 versus 3 in the back.
You might have noticed.
So
this
punctured.
warhammer has 2 ends. It also has a spike pickaxe.
Yeah, please don't use that end.
We gotta give that a little test.
Oh my god.
Wow, that's a Charlie horse.
Yeah, that's like gonna be so bad.
It's like a little rock here. You can see the bulge forming. The data has grown.
So the data is there. So the bulge and the rock is all just a swollen tissue that was there because of the puncture wound.
In conclusion, do I think the warhammer is an effective weapon? Yeah, it's pretty effective. It would hurt a lot to get hit by it. But do I think a warhammer could smack off the arms of a full-grown titan in one swing?
Nope.
I doubt it.
This video was inspired by Attack on Titan.
Oh, okay, very good. On a scale of 1 to 10, how painful were all of these injuries with this hammer?
Probably like a 6.
Okay. All right.
So it's like, it definitely hurts, but it's not like the worst thing I've ever, done.
Right.
To start off making the world's longest bruise, we're of course going to use this airsoft minigun.
What is actually airsoft?
Like a BB gun, but it shoots a little bit larger plastic BBs.
Got it.
This particular gun was powered with compressed air.
Hold your breath.
We can't do this video.
At least you did it faster.
There's so much more to go.
It's hard to put into words how painful an airsoft minigun that shoots like 40 BBs a second going into your upper back is.
I think it's the Crocs.
Oh, they're totally practicing. They're in sport mode. You see that?
We can't use them in the hospital because they're not closed.
Oh.
They have open, so we're not allowed to wear these.
Someone needs to change that.
Yeah, that's right.
I can feel the scientific knowledge flowing into my body. I need to fill in the cheek a little bit, I'm noticing. But my back is looking pretty okay.
Oh my gosh.
Those BBs, especially at that close range, can cut very, very easily.
Right.
You I said stop and you kept shooting.
Do you tell them, no matter what I say, if I'm screaming, just keep going?
It's kind of an unspoken rule.
What about our unspoken bond?
I'm obviously like yelling in the moment, but after it's all done, I'm like, that was pretty funny, man.
So it's been 2 days since we attempted to create the world's longest bruise. Check it out. Kabam!
Nice.
As you can see, there is a lot of bruising.
On a pain scale, how are you feeling?
That's an easy 9.
Oh, that was that bad?
Getting shot in the back, lower back for me, especially with like airsoft paintball, stings so bad.
Oh my gosh. The coating on them just looks awful.
This is the utmost confidence that I have.
Do you have water with you, I hope?
I think it's somewhere.
The point of the challenge was to see if your mouth would have any damage because of the Skittles?
I was gonna make my mouth bleed with Skittles.
Okay.
Alternatively, I was gonna see if I could eat 5 pounds.
Got it, okay. I haven't had anybody come in bleeding after eating food.
Well, I've definitely achieved it a few times.
Oh, okay, all right, all right. Oh my gosh, get in there. It probably doesn't feel good on your skin.
No.
Yes.
Flow to my mouth.
You want to know how many people come in the ER with things stuck up their nose? Like they do that and they can't get them out.
Oh, really?
We have devices specifically made, a balloon that goes past it to pull it out.
I luckily have big nostrils.
Yeah, perfect.
So they just blow right out of it.
It's been 2 days since I ate sour Skittles, and there's been an interesting development on my tongue. So I'm just gonna show you real quick. Here you
Inflamed
go.
taste buds? Oh, you burned it away.
That's right. It's shedding.
I will say, taste buds destroyed for a few days.
Yeah.
My mouth did not feel good for that one.
It's like a party in my mouth and everyone's throwing up.
Have you ever had any allergy? Or
I have no
reactions?
allergies, nope.
I wonder if it would be smart for you to have an EpiPen on set. Just something to think about.
What would it be for?
In case you get a weird reaction to something.
Okay, that I don't know of.
Yeah.
Let's see if we can get anything off there.
Yeah. It's like a bad sunburn to your tongue. That's awful. That, to me, looked more irritating than painful.
Overall pain, it was an annoying one, but like maybe 5.
Got it.
Just simply walking across hot coals.
Walking on hot coals,
For a man
okay.
of my caliber. I came up with a genius idea. Not only will I walk across hot coals, I will then add weight to my back. I am man. Man has 255 on back. Man walk across coals.
45.
There's a 45, 25, and a 35.
Plus the bar.
Yeah, the bar. So
simple, easy
yeah.
for Houston Jones.
Yeah, it's not too bad.
Oh. Keep moving. Just keep moving.
Yeah.
Don't stop.
So what we actually used for this was Traeger grill pellets.
Oh, Traeger, not charcoal.
Not charcoal.
Wow. Did that feel good?
Yeah, it
Okay.
felt a little bit relieving.
Okay. I always tell people, I'm like, once the burn happens, no matter what you do, it doesn't change the burn.
I felt for this one, immediately after not so bad. Following the next few hours, much worse.
Yep, because you're having an inflammatory response to the injury.
So it's been 2 days, and I got some interesting things to show you about how the bottom of my feet look. So first, let's start with my left foot, and check this bad boy out. It looks pretty dang good.
This is a good point to say. This is the second time I filmed this. The first time we did it, we did the same thing and we lost our audio. So this was shortly after we did it again.
Oh my gosh. So these are the things that not everybody knows. For the sake of filming, audio goes out all the...
However, my right foot looks a lot more interesting. Look at this thing! Look at that! And I did a little research. Apparently, these could be considered second-degree burns. But let's be real here, guys. I'm Houston Jones, the world's strongest man.
We actually characterize second-degree burn as second-degree superficial versus deep, and deep is almost like a third-degree burn.
Gotcha.
The way you pretty much would know is, did your feet healed? So it's definitely not a third degree or a second degree, because they wouldn't heal. You actually need a skin graft.
Clumps of cheese inside of like a creamy spinach.
That is a huge bowl of cheese. I don't know about you guys, but if you eat a lot of cheese, there's a higher likelihood of actually constipation versus the other way where you're actually having the runs.
Oh God, here it comes. Oh, my heart's pinching. Why? I'm only having cheese. There's spinach in here. See, my body doesn't like vegetables.
Well, people do have intolerances to certain foods. He's saying vegetables broadly. Typically, it's a subset of different type of species of vegetables that somebody might not be able to tolerate. And it also has to do with your microbiome, what's going on inside your gut. There's a lot of different factors that play into it.
The body can't handle too much fat. Okay, we'll be careful with this one. Oh, my heart's pinching. Why? Oh, oh no. What's happening?
Wait a minute. His heart is pinching, he's having chest discomfort. Heart attack symptoms are chest pain, chest pressure, nausea, potential vomiting, radiation of pain, sometimes down the arms, the jaw, the back to the neck, sometimes shortness of breath. You can have those very similar symptoms with indigestion, gastroesophageal reflux, eating too much, spasming of your esophagus. It is difficult to kind of discern the difference. You gotta really kind of be aware of your body, the symptoms that you're having, and if there's any concern, get to the hospital, get checked out, call an ambulance, get an EKG, that sort of thing.
That's what you get. That's what he gets for him. I get. That's what you get.
What a waste of a cake.
How dare you? How dare you? How dare you kill me? Stop! I can't see.
What a waste of a cake. But this brings up a point about getting a foreign body in your eye, cake in your eye. The first thing you do basically is wash it out. You can use normal sink tap water, it's fine. Wash it out, rinse it out. Could it cause a chemical type irritation, conjunctivitis? Yes, it could. So redness of your eye, irritation, but doesn't necessarily mean infection.
You guys, I am very triggered. I am officially 400 pounds. How did this happen? Oh, I've given up on myself. My weight loss journey is backfiring.
That is not good. No matter what anybody says, our bodies are not made to hold that kind of weight. It's gonna hurt your bones. Think about it. Your machinery has to work harder. You're bigger. And those populations where people live long, they're not big people. They're smaller, they're thin, they're always moving around, they have a good diet. So just something to be aware of. Obviously you can eat, do whatever you want, but if you want a healthy, long life, then just look at the people around you that are living that.
It's actually very disheartening. Where's the french fries? Let's set this up. Today is called Eating My Feelings. I've given up.
Oh my gosh, he's eating his feelings, which does happen when people feel like they failed or can't succeed. They're like, screw it, let me just feel better, I'll eat. You know, don't beat yourself up for that, but then you don't need to continue the next day doing the same thing. If you're having a great, you know, diet and you splurge one day, that's one day. Get back on the horse tomorrow and get back to your goals and your diet. Wearing his CPAP machine. He most likely has sleep apnea, most likely sleep apnea due to excess body tissue, especially in his upper airway, which causes it to close, which then he chokes himself awake, but not fully awake in the middle of the night, so he's not getting restful night's sleep. CPAP, or to be evaluated, you need to do a sleep study by somebody who's trained in doing that and be evaluated.
I've always said that avocado is my favorite fruit. That's how I got my name, Nikocado Avocado. Ooh, listen.
Avocados are good. Avocados are a good source of fat. Just be careful, don't eat a ton of it because fats are very high in calories, right? They're higher than a carbohydrate and they're higher than a protein.
You're not funny! You're not
guacamole.
You're not funny, put it on your hair.
The oils in the avocado and the guacamole there is probably not bad for your hair. It's probably actually good, giving you some nutrients. But what about the guacamole? Do you guys like guacamole? Let me know in the comments.
You got it on the wall. I did not get it on the wall. Don't touch my guacamole. Don't touch my guacamole. You're not funny. Eat it. Eat it. Eat it. Here.
What a waste.
On your hair.
This is funny, but be careful. He's choking. You don't want to aspirate. You don't want to suck this into your airway, which then can cause pneumonitis, which then could potentially lead to an infection.
I don't know how long it's going to take. Yes, I have broken 3 ribs.
A broken rib, a bruised rib are very much similar in pain because you're moving your chest wall, you're moving the ribs, and you can't prevent that from happening, so it's gonna basically move on the broken rib. As you breathe, it's literally moving. So it takes a long time for it to heal and cause a lot of pain.
The first hard part is I don't know how long it's gonna take to heal. These things can take people anywhere from 12 weeks to 15 weeks. Weeks? Like months.
Weeks. What can you do to actually help heal ribs faster? Well, optimize your diet, get rest, a lot of fluids, basically make your immune system as best it could. But then the things that we do to help are to actually prevent secondary problems such as pneumonia or like constipation from the medications that we're giving you for the pain. It really, really stinks.
He did not bring up my trachea. He said he did mention the heart, which is not inflamed. He said the lungs look fine. But the, ouch.
It's not the best x-ray in the sense of it is not a good, the amount of ribs that you should see, 10 to 12 ribs, 10 to 11, you're not seeing as many. So it's not really a good full picture of the ribs and the lungs, but you can see the heart there. Yes, you can see the dark line in the middle. So air shows up as like black. Okay, so that's why you have the lungs and then everything else is kind of white because it's just more dense tissue. So the trachea is midline. What he's actually talking about is the branches off of that further down, and you just can't see the left side as well because of all the tissue that is there. So, okay. And now, why is he cutting his hair over eggs? And what's he doing? Why is he upset? He seems sad. He's cutting his hair, it's very dramatic music and using food in a weird way. It just seems sad. There are other much more healthy ways to maybe overcome some sadness. Get outside in the sun, exercise, talk to people, get rest, drink a lot of water. There are other things that you can do to actually then feel better.
Let's get into our top 10 injuries of Smosh. Number 10.
Number 10. Okay, first though, I love it. They have bandages on, but don't put a circumferential bandage around your neck like that if you can prevent it. Sometimes you can put it on too tight and then you're compressing your blood vessels around your neck.
There was a scene where we were like freaking out or something and I was like, "Wah!"
So the C collar that is on him is what's called a type of aspen collar. It appears. So you see there's Velcro on both sides and it actually has more of a cushion. Typically not the type of C collar that an ambulance will use or at the hospital.
And I was like shaking all over. And I think that was the first time ever that I like threw my neck out.
He throws his neck out. What does that actually mean?
What do you mean?
Does that mean you have a spinal cord injury? Do you like fracture a bone? Do you just have spasming of the muscles? Did you pull a tendon? Did you rupture a ligament? Did you cause a spinal cord injury because of a disc that was slipped? There's many different things that could happen.
Number 9.
Number 9.
Put it in reverse and...
Oh! So number 9 is a car versus pedestrian. You have to worry about whiplash injury and then landing on the concrete, hitting the ground. This direction, you see a hyperextension injury. You can snap the knee, crack the femur, you can crack the tibia.
Number 8.
I can't see, what does it say?
It says a delicious smoothie. You're going down!
Oh, luckily our eyes are typically so advanced that your eyelid actually shuts really, really quick and tries to protect it.
Oh, there's a blooper, extra bloopy moment. Let's just see it. Let's just see it.
You're going down!
As long as it's not through the eyeball itself, they'll heal on its own. We'll probably use some ointments, typically a topical antibiotic ointment. Sometimes if there's an ulcer, you need a little bit more treatment and maybe a contact lens.
Number 7.
Number 7.
Ian's kidney stone.
Oh.
Yeah, so we don't really have a video of this.
Come on. That's not the size of a kidney stone. A kidney stone is a very hard kind of mineral deposit. We unfortunately see these individuals that have the kidney stone move into the ureters can cause horrific pain at the size of 1 millimeter.
Ian getting waterboarded.
Waterboarding.
Favorite summertime activities like swimming lessons.
You're swimming, Billy!
I don't think they're actually doing that technique, and I don't advise that. That's highly dangerous. You can have somebody succumb to the aspiration of the water into your lungs, difficulty breathing. Stress of this can lead to cardiac arrest.
Cardiac arrest!
A lot of different bad scenarios, so please don't do this.
How horrible is that?
Is it terrible?
Luckily, we don't see anybody that comes to the emergency department with these exposures, but we do get people who get near drowning exposures. So if somebody has drowned, that means they've actually passed away from the drowning event, versus near drowning, they've survived.
Number 5.
Anthony's hernia in Smosh the movie.
Hernia is when part of your intestines pops through a defect in typically your abdominal wall somewhere. If you do get an abdominal type hernia and you can feel the lump, put pressure to the area and just hold it there, and eventually the intestines will try to suck back into the abdominal cavity.
Spoiler alert, I got a hernia. I'll let you know when. Okay. Right there. It was somewhere around there, dude.
Typically, if the defect or the hole is small and the intestines pop through, that is when you're at the highest risk of causing ischemia and dead tissue happening to the intestines, because the blood vessels are around the intestines, and if the hole is very small, you're going to compress those blood vessels and the tissue is eventually going to die, and then you'll need emergent surgery.
Number 4, Ian knees himself.
Here it comes.
For sure.
Oh.
Oh!
Right,
nasal injuries.
Your nose!
Increased risk of having a nosebleed and a nose fracture. Typically, if you're bleeding, there's a lot of pain and it's a little crooked, you have a nose break. Do we necessarily need to get an image of that? No, but a lot of people want to see it or have it.
You really hit yourself in the nose.
And it looks like
If it is a fracture, majority of the time they're non-displaced or minimally displaced, so you just let it be and wait for the swelling to go down. If it's still crooked, you see an ear, nose, and throat doctor or plastic surgeon have it fixed.
We definitely added...
we added a loud hit sound because you couldn't hear it.
You gotta be careful. I've never broken my nose, but I've had it hit many times playing soccer, and I've had many nosebleeds from it. You also have to worry about infection. Considered an open fracture if you're having bleeding plus a fracture there.
Number 3.
3.
This is Jackass.
Oh, so interesting, right? Like, none of these seem bad, but people do injure themselves even if it doesn't look bad.
I mean, we're just asking to get hurt. Oh! That was it.
Well,
body slam to the ground and whiplash head injury. It's on the ground, so the dirt gives a little bit, but not that much. Somebody's complaining of head pain, neck pain. If there's concern for skull fracture or intracranial bleed, we'll get a CT scan versus just watch and observe.
Number 2, Anthony and YouTube Rewind, severed thumb.
They gave us glass champagne glasses.
Yeah, and they kept telling us to hit him harder.
Here's what they got.
Oh gosh. A lot of times with glass injuries, we'll actually get a quick x-ray because you can't see glass if it's in the wound, but an x-ray will actually light it up. You can confirm that you're not sewing a foreign body back into a wound.
The stem of the glass flies towards Anthony's hand, and here's the injury photo. So you cut your finger.
Laceration to the thumb on the medial aspect. The nerves run there as well as the blood vessels.
There was a medic that was on set, and he was like putting bandages on, and it just kept bleeding.
Keeps bleeding because the major blood vessels are on either side of each digit. You just put a decent amount of pressure on it, just with your own finger and maybe a little bit of gauze, and hold it for a while, and just don't take it off. That way it actually just stops bleeding.
Number one.
Number one.
Oh.
My broken nose.
Did it actually hit you?
Oh my gosh, he actually hit him.
Literally felt my nose crack sideways.
Did I break it?
And then I moved it back in the other direction.
I do think it's appropriate if you immediately see like you broke your nose or you have a dislocated finger, grab it, pull it straight, or do something really quick, because then the pain actually will be the least amount at that moment.
At least it looks realistic. It was perfect for the scene.
It's a little off there
It's still a little crooked.
As it healed, it was still crooked. It happens, and then you can go back and have surgery if you want to have the nose even adjusted more. Majority of the time, yes, for cosmetic reasons, but you also worry about any appropriate breathing.